in regard to particular non-medical therapies that I think may be valuable for both men and women, in some of the studies having to do with oxidative stress in animals, they found that supplements like N-acetylcysteine, also known as NAC, or vitamin B6 and the amino acid cysteine, were actually able to prevent the kind of hair loss that occurs from, for example, the oxidative stress of cigarette smoke. And those types of supplements, while they have not been proven to have that effect in humans, are certainly benign supplements. They can't hurt you, and they may be able to help with mediating the types of oxidative stressors that are encountered in the environment. Other supplements that patients may consider are vitamin D, which is good for the immune response, and that always seems to be good for hair health. The medical therapies for hair loss in men and women are currently essentially the same, and those include the FDA-approved minoxidil or Rogaine and finasteride, the oral pill. The reason that these therapies are effective have to do with the fact that minoxidil or Rogaine is a general growth promoter of hair follicles. Finasteride, however, is much more specific to the type of hair loss that occurs because of genetics and androgens, in particular dihydrotestosterone or DHT. That means that women who have hair loss relative to non-androgenetic causes will not likely respond to finasteride, but men who have hair loss relative to genetic causes are 90% likely to respond to finasteride, which is why those therapies are chosen differently depending on your gender. So for men, the 1 milligram of finasteride therapy a day is a very effective treatment and is often more convenient than the topical Rogaine, which needs to be applied every day, twice a day, to get maximum therapy. In contrast, men can take finasteride therapy 2 or 3 times a week and still maintain the same benefits as long as they're receiving a sufficient amount of medication.